All right, so this session is now being recorded, and we are recording this and posting this in our YouTube account and also in our Facebook account, just so if there will be people who have missed this session, they can revisit. So, as you guys, you can all revisit this session as well. If you have any problems with the recording, please send me a private message so that we can we can either we can either not show your name if you don't want that, but I'm happy for you to also not share your camera. But guys, if you can share your camera, please do so. It would be very good for us educators to have that sense of connection. In our real classes in OSCE, we require all of our students to actually share their camera. It just gives us that very good online discussion. So I'd like to begin by acknowledging the traditional owners of the land in which we work and live, and that is Australia. And we'd like to respect our elders past, present, and emerging in Australia as well. So, welcome everyone for this demo class for NETA, and this is understanding how to conduct a telephone order and the National Inpatient Medication Chart, or NIMC, documentation. So Ross is our NETA educator who will be with us today, and he's just waving his hand, but Ross will do his introduction as well. So, my name is Carissa. I am also a nurse educator in NETA, and Ross will be leading the discussion today. So, thank you so much, Ross. And Pramod, thank you very much for sharing your camera. That's very good. All right. And so, as Jatinder, thanks for sharing your camera.
Thanks, Carissa. How's everyone going, guys? It's a rainy season here in Sydney, if you're around in Sydney. So we'll begin. So just a quick introduction about what we're going to do today. So this is a demonstration OSCE session that we normally conduct. And this will be around, your understanding of telephone order. So my name is Ross. I'm currently one of the nurse educator working with NETA. My previous background is 10 years plus in clinical cardiac. So I was working in a cardiac ward for quite some time. I currently work in the Australian College of Nursing, so I coordinate different courses in there. So, and like what I said to Carissa when I started with NETA, the re-entry and bridging course, and the ones that we deliver now as an OBA is very close to my heart. So, I'd like to sort of share some knowledge and information about how you get by, with this OBA. So I'm pretty sure you're very, very familiar about the transition that we have from the bridging to what we do now. So it's good that you can join us today, everyone. And this is just a demonstration session of how we actually do our OSCE lectures and face-to-face, which is part of what we do with this session. And hopefully, you'll be enticed and sort of like encouraged to join us in the future should you wanted to, do some, reviewing for your OBA. So let's begin, everyone. I'm pretty sure you can see my screen here.
Yes, we can see it, Ross.
Yeah, I'm just gonna have to move all these little square boxes on my side, Carissa, because I got like pictures and chats and things. All right, so firstly, guys, we wanted to see what we're actually trying to achieve for this session. So since we're talking about telephone order, our objective for this session is to provide information and demonstration on how we actually conduct OSCE here in NETA. So at the moment, because of the COVID situation, we sort of do an online sessions for 2 weeks, for the OSCE itself. It will change eventually depending on how, the current situation will flow. And then we dedicate another 1 week, 1 to 2 weeks for the actual face-to-face, depending on the situation. So we normally run the session 1 to 2 hours per day for the whole 2 weeks. And we have a roster for the afternoon and for the morning sessions as well. So if you'd like more information about that, you can contact our, our administration and, ask for more information. So We do obviously use Zoom sessions for most of our lectures. This is probably the most common thing that everyone uses now. And Zoom is very good in engaging students and being more interactive. So even though we've been delivering this as an online, blended face-to-face, we've actually got some really good feedback from the students, which is amazing, considering that we only get to see in small boxes. So we also wanted to facilitate the understanding of the skill. The specified skill today is a telephone order. So I'm pretty sure most of you has done some telephone order in the past. And what we really wanted to achieve here is what are the sort of differences on how you actually do it back in your country or back where you practice, and how do we adapt it here in Australia? Because there may be some similarities and changes. And what we wanted to see is to demonstrate to you how we actually do it in a real life scenario here in Australia. Okay. So we're going to do some sort of visual activity presentation. We're going to do a bit of role play, me and Carissa, later about how to do a telephone order. That's something you'd like to see. I will get you to do it as well first. Okay. Let's see how much we have in, and then we'll sort of break you into groups. Understand how to properly document the telephone order. As much as we would like to do a lot of telephone order, there is some policies and regulations obviously related to documentation, proper documentation. Like in the court of law, you need to make sure that you document everything, especially if it's a medication, isn't it? So our job is to make sure that you understand how to work on documenting on the NIMC, or the National Inpatient Medication Chart that we use in Australia, and how to read a valid order and how to deliver a valid order. And finally, feedback on acquiring the skills. So we're going to have a quick feedback about how you think about this session, and if there's anything that you'd like to add and improve in things. All right. Any questions so far, everyone? I hope that sort of, we just need 1 hour of your focus today, and just, we're going to have some good time today. I hope. All right, let's have a look at the question. So I need some sort of like, voices. So this is the time that I can possibly either hear from your experiences. Who here has done some telephone order in the past, back where you're practicing? Have you done some telephone orders before? Anyone wants to volunteer? Or should I call names?
Please don't forget that you are on mute, guys.
Unmute. So you have to unmute yourself and you can talk. Anyone has done phone orders before, guys? No, I'm sure you've done some. Yeah? Should I call names? Carla. Carla's the one on my box today. Have you done phone order, Carla, before? You can unmute yourself. Do you know how to unmute, my dear? Yeah, she is.
Hello,
yes.
good morning.
Yes, yeah, hi, Carla. Have you done some phone orders before, Carla? You remember? That's okay if you haven't yet. Have you remembered anyone doing phone order before?
Yeah, I did some before.
Yeah. So how was it? Is it like a good experience, or is it something that you didn't want to do again? Or did you have a fight with the doctor?
No, I have I have experience before here in the Philippines.
Yeah.
Many times actually before.
Yeah.
So it's a common practice here.
It's a common practice. That's good. That's good.
Telephone
thanks for that,
order.
Carla.
So I don't have any unusual experience, just the usual procedure.
Good.
So
We'll see how we tailored it based on your old practice, on your previous practice.
Yes, that's why I'm interested to learn the difference between how we do it here and how you do it there. So
yeah, absolutely.
I can see the
All right.
difference.
Thanks for that, Carla. I'll have one more volunteer. Pramod, do you want to say something? Have you done some? Sorry, I can only see a few boxes of faces, guys. Have you done telephone order before?
Based on my experience, I did, but I'm not remembering.
That's fine. Yeah. So you've done it before.
Yeah, I did.
Yeah. How do you feel about it? Feel confident about it?
Yeah, feel confident. It's back in my own country, in our own ways, but I don't know. It's based upon the Australian standards.
Absolutely. Yeah.
Might be different.
Yeah. So my follow-up question with you guys is, how many nurses do we normally have? And I'm pretty sure you would know this when you're actually doing a phone order. And who are the people involved when you're doing a phone order? Does anyone know? Yeah, Pramod, you want to say something?
The physician.
Sorry, say that again.
The physician, the doctor involved.
Yeah, the doctor. Yeah, and how many nurses do we normally have when you do a phone order? Can you do with one nurse only?
I think for telephonic orders, we need to have two
Two
RN.
nurses.
Yeah.
Yep. All right, and we'll get through to that later. Like, who are those nurses? Because as you may know, in Australia, we have different kinds of nurses. Okay, there's an AIN, there's an EN, there's there's an RN, there's a CNS, and so on. So we'll sort of like determine which one are the most appropriate to do telephone order. So yes, you need, if you've done a telephone order, there might be some sort of just quick tailoring about what what you do, and hopefully we can explore more about the idea of the challenges when you actually do phone order. Just to share with you guys and to you as well, Carissa, when I did my first phone order before, I was scared because the doctor that I was on the other line was so nasty. And I didn't know that I have to grab someone beside me to hear the phone order straight away. So, because I just take a phone order, I ask for a phone order, and I don't have another RN beside me to actually listen to the order. So I got into big trouble after that. But now I know, sometimes there are some few issues like that you get to learn from it, I suppose. Yeah. You've observed someone conducting a telephone order, I would assume, and these are the things that you might observe. What are the difference in practices in telephone order back in your country? So is there any particular thing that you do differently when you were practicing with telephone order? Has anyone got some, weird sort of, practices for telephone order before? Do you remember?
Ross, I'd like to share my experience.
Sure, go ahead, Chris.
Because I am also a trained nurse overseas before I became a registered nurse in Australia, and it's quite different. And I think this is very important for OSCE that we have to unlearn what we do back home and relearn what we have to do based on what is in the book or written in the book. So when I was doing a phone order back in the Philippines, I remember that I was the only one listening to it and then asking the doctor to sign it, looking for the doctor, chasing them before the end of my shift, just to make sure that they actually sign the telephone order that I asked for. When I was in Australia, telephone order needs to be with two registered practitioners, and these are registered healthcare practitioners, specifically nurses. And I think you will cover who are these people later on. And also, I don't have to chase the doctors. Like, it was very good that they know exactly that they have to come within 24 hours, because that is also part of their accountability, that when they actually do a phone order, they have to do it within the next 24 hours. I was so amazed that after the phone order, in the next 20, 30 minutes, they come there, reassess the patient, and then sign the phone order. So that was really good. And I thought, when I was in the Philippines, it was quite different because aside from doctors just saying, oh, give paracetamol, I just write down paracetamol, and then later on, I have to chase them in my available time. So that's the difference that I see in the practice.
Thanks for that, Carissa. And you might get some similar sort of experiences, I would say, back in your old practices, isn't it? And based on what Carissa said, it feels like, I'm not generalizing, obviously, but most of our doctors are a bit more, how do you say it? Entitled, isn't it? Yeah, and I think there's a lot of cultural differences of what you've experienced here, because everyone is accountable to what kind of decision, particularly with medications, guys. We don't want to mess up with medications, don't we? So these are the things that you need to be accountable for, and then also with the other health practitioners. So do you find that telephone order is effective, guys? Do you like doing telephone order? I personally love it because you don't need to chase doctors. You can just ring them and ask them what you want. But do you find that it's effective? And what are the instances that you've actually had to use it? Yeah, I suppose so. Okay, no comment means good. Okay, all right, let's move on. we'll sort of see how it actually applies to our clinical practice. So telephone order, guys, so we just shortcut it as a phone order. It's a way to provide a medication or any kind of selective management. So it doesn't have to be restricted with just medication, but for this particular demonstration, we're just going to show you the medication management for phone order to a patient when the medical practitioner or physician is not available physically, to provide the order. So this is when you have to sort of ring someone, the doctor or the MOs or whoever is the visiting medical officer, to give a phone order for you for medication because they're not physically there. A phone order can be used at times when there's an emergency situation, especially when you're having a code blue or a med call. So these are the times that every single one of you will have to coordinate, and most of the medications given in the emergency is provided as a phone, not really a phone order, but more of like a verbal order. So this also extends to the phone order responsibility. Oh, thanks for that drawing, Carissa. Oh, so who's drawing? Someone's putting a drawing on my. All right, a phone order requires these people. So a phone order normally requires a medical officer. So if you don't know what MO means, it's a medical officer who looks after the patient. A 2 registered nurse. So these 2 registered nurse can be an enrolled nurse plus another RN, or it can be a registered midwife. Okay, so these are all like what Carissa mentioned. These are registered professionals. Okay, so you need these people in order to complete a phone order. So are you aware about the titles of enrolled nurses and RMs? Have you heard of these group of nurses before? Yeah, Promote is nodding. Yeah, Gia, yeah. So enrolled nurses are under the direct supervision of the RNs. So they can do basic sort of thing like assessments and things, but with any other, higher responsibility, they need to report to the RNs, okay? So they have their own registration, as you may know. If you look at it in the perspective in American practice, they're called the licensed practical nurses, or LPNs. So they're the same thing as what we have. Registered midwives are entirely different. So they're midwives who can be a registered nurse too, but they have their own specialized registration as well. And they can obviously check, with the telephone order. Now, telephone order may vary on specialty and areas. In the aged care, it's quite different, guys, because the aged care telephone order is, it's a bit more different in regulation. So, and then the doctors will normally, have to visit anyway in the specific time frame. So note that registered midwives can also perform a phone order with registered nurses, just like ours. So this is under the Australian Commission on Quality and Safety standards. All right. Moving forward, everyone. Now, these are the steps that you actually do when you do a phone order. A telephone order is instructed may be required when the written order is not available. So this is when the time that you sort of need some, medication order that is not written on the chart of the patient, the medication chart. A telephone order is required when an RN has to verify with the person is an authorized provider, which is your doctor. An RN must also order and dictate the medication, dictated on the medication chart in the telephone order section, which is I'll show you later. There has to be a second nurse, so you can't do phone order with just one RN or one person. Responsible to verify the order, which is what we call as a witness, of what the order has been said. And we'll demonstrate all of these to you later. Both the RNs and the second person will have to sign the medication chart, because why? If it's not signed in by the person who took the order, then that's not valid, isn't it? Because there's no sort of, proof that that's been done. And then finally, authorized prescriber, like what Carissa said, you need to get them to sign within 24 hours. And normally they're very, very good at, signing the doctor's order. Because if something happens to us, let's say you've administered the medication and it hasn't been signed within 24 hours by the doctor, and there's a reaction, or the patient had a reaction, that will fall back on both of you. So responsibility of the nurse is she or he didn't chase up the medication order to be signed off. The responsibility of the medical officer is he failed to sign the medication as a valid order. So you're basically giving a medication that is not valid. That's how we would transcribe. So make sure we know all our responsibilities around that. Now, also additional information, guys. So I'm pretty sure you're very familiar with your Scheduled 8, the Scheduled 8 medications. So these are drugs of addiction. These are normally prescribed in the PRN. However, if you feel that you require your patient to have a higher, some sort of scheduled medications, you can actually do this as a phone order. So that doesn't really stop you from giving, medications as a phone order. Now, the second person must hear the authorized prescriber's order and repeat it. Can you, as a second person, just pretend that you've heard what they said? How do you actually verify that you've heard it correctly? If I'm the second person who's taking the phone order from the doctor, how do I verify that I've actually heard the doctor's order correctly? Anyone? Is there a way to verify that what I've heard is, because what the doctor said might be different to what you heard, isn't it?
Read back.
Say that again, Pramod.
Read back.
Yes, excellent. So what we have to do, and the normal practice that we do, is you actually read back to the doctor and to everyone who's involved in the phone order about the telephone order that was given. And while you're reading that back, then obviously, the doctor can correct it, and you're writing it on your medication chart. So that's when it's all valid. So that's why we have two people to actually listen to it, because let's say me and Carissa are doing phone order. If Carissa heard it differently, I heard it differently, then we can sort of, consolidate and see what is the actual correct order. Because I might have hearing problems. It might be noisy. It might be like the line is really bad. So there's a whole lot of different, problems associated with it. Also, authorized prescriber has to sign within 24 hours. That also includes verbal instructions as well, guys. Verbal instructions particularly happening in emergency cases, because a lot of doctors will just say, oh, give adrenaline 10 milligrams, give me morphine 5 milligrams, so on. So you just sort of go with the information, but that has to be signed, and someone's scribing it to be signed within 24 hours. Now, as we go through with this session, guys, our usual pattern on how we do our OSCE is we refer you to what we call the Student Handbook. So we do have a Student Handbook which has skills on it. And there are different lessons that cover the different areas that we talked about. Now, this is something that will be distributed to you when you started to enroll for our OSCE session. And, your responsibility as student is to complete those lessons or the activities on that on the student book within a period of time. There's a time frame that we give you a due date. Now, on part of this is just a screenshot of what we have for our lesson for medication administration. So under lesson 7 on your student handbook, you can see here the different responsibilities of registered nurses in regards to medication administration. So the phone order is under the medication administration lesson. So there might be some specific questions that you need to answer. And what we encourage everyone, guys, is when you start joining our OSCE session, we call it as a flipped classroom. And what it means is you need to do some prior reading or pre-reading before you come into the session. Because as nurses, guys, as you may know, this is adult learning. We expect you to actually done some sort of pre-reading and you have a basic knowledge about what we have to do. So when I come back, let's say we start the session for the OSCE, I'll say, oh, Gian, have you read this? Have you done that? And we don't really want to hear something like, oh, look, I didn't read it. I didn't know I have to do it. So because it's for your own learning, guys. We're trying to build your skill in order for you to be competent enough when you do your OSCE OBA. All right. So just to remind you, we sort of go back and forth with our handbook. There are some discussions on the presentation that we do, but we always refer back to our handbook to make sure that you've completed the activities. So is that okay? Yeah. It's just a good way, to sort of make sure that you guys, like not all the hard work is from us, I would say, that you have to do your own bits as well. Now let's look at the medication chart, guys, and completing documentation. Now, if you're not very familiar, this is the section where you actually write the phone order. Now, I cannot show you the whole medication chart, but this is just one section on the standing order sheet that we call, which is in front of the medication chart itself, the NIMC. So you can see there's a telephone order, signed within 24 hours. It's very specifically said that what you have to do. And I broke it down for you later. There's date, medication, and so on and so forth. So The sample here is for you guys, and I just showed it to you. Let's see if I can enable my nice pen. I've never done that. Here, actually. Highlight. Let's see if I can do this one. So the first one, guys, is date. You can see the date in here. So when I do a telephone order, which we'll show you later, this is where you write the date of the medication. So whoever's doing the phone order, now you will now ask for whatever the medication order is. And it has to be written in what? In generic name. You can see the sections right in generic name. The nurse who's going to be receiving the phone order will have to write it around here. The route or route of administration, is it per RM? Is it IV? Is it subcut? Is it IM? The dose, make sure you know the dose and write the dose itself. Is it milligrams, grams, or whatever? What is frequency? How often you're going to give it? Is it a once daily? Is it a stat dose? Stat dose means just now, one off. Is it something that you have to give regularly, or is it a PRN? So you would normally see a stat dose on a telephone order or something like a PRN. Because a telephone order is like what it's a one-off medication, isn't it? And then when the doctor comes in, what they'll have to do now is if they wanted to continue that same medication, then they'll have to write that on the actual medication chart as a regular order, not as a telephone order. Does that make sense? So normally what you see in a frequency is more of like a stat dose or a PRN dose. Now, if you can see this second, the next column here is like nurse initials. So this is nurse 1 and nurse 2. So this is me and Carissa, whoever's going to do the phone order will have to sign, okay? So there are 2 nurses to sign here, okay? The next one's prescriber name. So you should know the name of the doctor. What if you don't know the name of the doctor? What do? Do you just pretend, just leave it blank? Can you do that? No. So what do? You ask for the name, okay? Ask the name. Don't be shy. You have to be proactive. So ask the name. Sorry, doctor, I didn't get your name again. So, and then the Dr. Smith or whatever. So they'll write the name in here and they can sign this up for you. Okay. Because if you don't know the name, guys, how would you know? How do you chase up the doctor? You would never be able to chase up the doctor by just recognizing the voice, when you call them. And they can sign this one when they come back. So the prescriber signature will be on the date. You can leave that or you can sign it too. But normally the doctor will put the date on it, especially if it's in break of night shift moving to morning shift. So the date will change. The time given, we'll leave it blank for now, okay? Because the time given and the signature will have to be signed off after you've actually given the medication, all right? And we'll show it to you later how we do that. So there's 2 sections. One is for the time and date, and the other section is where the nurses actually can sign up. All right, so how do I clear this one? Just move forward, okay?
Rose, may I ask you one thing?
Absolutely, yeah.
For the S8, the phone should be in loudspeaker so that the other RN can hear.
You mean a loudspeaker, did you say, Pramod?
Yeah, for the
Okay,
S8.
So that's a good question, actually. Is that how you practice back home? Is that how you do your practice when you do a telephone order? Or just something that come up to you?
Not following this much, intense policy. Yeah, we are doing it safe, but not like this. That's why I'm asking. Yeah.
No, that's a valid question. So the answer to that, Pramod, is we don't do a loudspeaker when you actually receive a phone call. What we do is we pass the telephone to the next person.
All right.
Yeah, and I think part of that is something to do with, I would say, confidentiality, because you never know who's listening around in the ward, isn't it, Carissa? I would say that's probably the most reasonable. I've actually never come across with that. It's interesting, isn't it?
Yeah, this question actually was raised by one of my students during the bridging course. So the practice back home is they put it in a loudspeaker so both of the nurses can listen. In Australia, it is best practice and it is highly recommended that we don't put it in loudspeaker. The reason is it should be a valid telephone order, and when you say valid, it should be validated by 2 nurses. So what the doctor said in the first instance of the telephone order needs to be the same medication dose frequency heard by the second nurse the second time the doctor repeats that order.
Yeah.
So it's like your medication calculation, which would be another demo class where we
Yes.
have an independent medication calculation. What does that mean? Not two nurses will compute together. Two nurses actually will independently compute the medication dose. So it's that just the same as a phone order. So
Yeah.
there should be an independent listening and
Mm.
independent validation of the order.
That's only for S8, right?
No, that's for
Yes.
everything.
So S8, the doctor will repeat the question, not the question, the
The
order
prescription. Yeah.
twice, and the two of the nurses will repeat it twice as well.
Mm.
With the normal medication, we still do not put it in a loudspeaker.
Mm.
Um, but the
Only,
doctor may not repeat the order. The nurse will just confirm.
only the second RN only needs to read back for the
Yes.
all other
Yes.
medication.
Yeah, we'll
Yes.
show it to you in a bit, Promote, so it'll make more sense. And that's actually a good question because never come across with that before. But it's good that we sort of validate all our old practices and how we actually do it. So thanks for that, Carissa. So moving on, guys, it is important to make sure that the phone order has been completed and it's valid, because if you haven't completed filling up all those boxes, then it's not a valid order, isn't it? Because you need to make sure you're giving a valid order. In the court of law, it's going to be a problem if you're given something that you didn't validate or it's not complete. You need to remind the medical officer it has to be signed within 24 hours. They're normally pretty good with this. Administer the phone order as soon as you can. You don't really want to delay this, because a lot of times, I know we get so busy in the ward in the hospital, but if you just leave the phone order hanging in there, then it might get forgotten. So once you've got the phone order, particularly with scheduled medications drugs, you don't want to leave it up until whenever. And there's a reason why you're asking for a phone order, isn't it? Because you wanted to get it now. So that's really what we wanted to do here. Make sure you document, sign legibly. In what we use now in the hospital with EMR, which is the electronic medical records, this is validated. So because everything that we do now for medication administration, guys, is on the computer. So what it means is when we validate the signature, it has to be, like me, let's say, and Carissa will both log in. I will log in with my account on it. And for her to validate the phone order with her signature on it, she will now have, will be prompted to log in with her details, with her user and password. So that's how we sort of, validate this phone order. And obviously, when you give medications, you want to watch out for side effects. And this is a basic medication management, responsibility. All right, let's now apply a phone order. All right, so I'll read to you the scenario. So me and Chris will be the nurses, and who wants to promote? Do you want to be a doctor for me? I would assume. We need a doctor probably. So our order is an endone, 5 milligrams stat dose per orum. All right, so that's what you want to give us. Oxycodone endone, promote. Per orum, 5 milligrams stat dose. Okay. And we'll guide you through with this one. So if we don't get it correctly, that's fine, guys. We'll reinforce this. Okay, it's just for everyone so you can see it. All right, let's walk at scenario one, guys. So Mr. Surovsky is admitted to the surgical ward day 1 post-thyroidectomy. So this patient is still having pain on the surgical site, I would say. He's currently complaining of pain, surgical site, 6 out of 10. So it's a moderate pain. He's only written for regular Panadol and Nurofen. That's probably not going to be good enough for him. He's got a history of diabetes, hypertension, hyperlipidemia, and also the nurse is concerned the pain gets worse. Now you are now inclined to ring the medical officer to seek advice. Now, before we start this, guys, I'll be the one calling the doctor. I'll be the first nurse. Carissa is my second buddy nurse. And before you actually give a phone order, guys, you need to make sure that you sort of give a very precise handover to the doctor, okay? And this is a mandatory thing that we do when you're referring to a doctor, or you're referring to a nurse for opinion, or you're handing over. You need to give a specific sort of handover, because promote, the doctor wouldn't know what this patient is. I can't just say, oh, promote, can I get a painkiller for this patient? Or who the hell is this patient, right? So we do follow, on the particular lesson that we're going to do sometime in the future, if you're with us in Oski, we'll have to do what we call an ISBA handover. ISBA stands for I for identification. Have you heard of ISBA before? Probably yes, some of you. So I is for identification, identify yourself, introduction of yourself. S is for situation, B for background, A for assessment, R for recommendation. So I'll show you how it's been done in a really quick manner. And then what we have to do is just to sort of see, how, and this is something that you apply for almost every kind of situation like this. All right. So Pramod, are you ready?
Yeah, sure. Thank you.
All right. So I'm going to ring.
Hello.
Hello. Is this Dr. Pramod?
Yes, it is.
Yeah, Dr. Pramod. Hi, my name is Ross. I'm calling from Ward C. How are you?
Fine, thank you. Hi, Ross. How are you?
Good. Not too bad, not too bad. Doctor, I had this patient I'm looking after in bed 1, Mr. Sorovsky. He's admitted in the surgical ward, day 1 post-thyroidectomy. He's actually complaining of pain in the surgical site. It's 6 out of 10, so it's a bit moderate pain. He's only written for Panadol in Europe, and then he still wanted to get some, I wanted to get him some more medications for this one. Now, he's also had history of diabetes, he's got hypertension, he's got cholesterol issues. I'm just concerned, because there's nothing written as a PRN for him as a stronger painkiller. Is there any way that you can probably suggest a stronger painkiller for him, please?
Yeah, sure. The pain score that you have mentioned is 6, right? 6 out of 10?
6 out of 10, yes.
All right. And then you can give oxycodone.
Yep.
5 mg.
Yep, 5 milligram.
Yeah. Per oral stat.
Yep. Yeah. So I'll just repeat that order, Dr. Pramod. So that's oxycodone endone 5 milligrams per oral stat dose. Is that correct?
Yes, exactly.
Excellent. All right, Dr. Pramod, I'll just hand you over to the nurse, to the other nurse, please. Carissa.
That's fine.
Hello, Dr. Pramod. This is Carissa from Surgical C, working with Ross. How are you?
Fine, thank you. Hi, Carissa. How are you?
I am well.
That's great.
Do you mind just repeating the order for me, please?
Yeah, sure. Endone 5 mg per oral stat.
All right. Can I just confirm it is oxycodone 5 milligrams per oral stat for Mr. Sorovsky?
Yeah, exactly. Thank you.
All right. Thank you very much, Dr. Pramod. We will expect you in the next 24 hours.
You're welcome. Sure. I'll be there.
All right. So that's it, guys. Thanks for that. Either Carissa can pass me the phone if I need to say more things about the patient, or Carissa or the second nurse can actually do the closing. It's good that if you've seen how it works, guys. Carissa mentioned, reminded the doctor that they need to come in 24 hours. Just a quick reminder. So now what we're gonna do, me and Carissa, do you have any questions to that, guys, by the way, before we proceed? How do you find that?
So when we ask the doctor regarding the medication, should we only tell the generic name? Because I have mentioned endone, but you both guys asked me oxycodone.
Yeah. So, in reality, Pramod, the doctor should be giving you a generic name.
All right.
Unfortunately, doctors are naughty and they just assume that we know what it is, and we actually know what it is. So, but there's some sort of like an understanding about these medications. But in reality, when you still write it on the medication chart, you write it as an actual, and we'll show it to you later. You actually write it as a generic. Okay, you can put the brand name on it, but there has to have some generic name on it.
Yeah,
some doctors are good. Yeah. Most of them are naughty. Some of them are good. Okay, some of them will say oxycodone, endone, but endone is like a universal term for the number 1 medication that we give post-op. Really, you're not gonna go. Yeah, it's very, very popular, and that's how you just mostly say it. So
yeah, for 20 seconds I became a doctor. That's why.
Dream come true, Pramod. Any other questions, guys? Does that sound a bit clear to you?
I think that was a very good question from Pramod about the generic name and the brand name. So it is a recommendation by the NSQHS, which did the standards, that all medications need to be written in generic in their generic form or the generic name. There are instances where the doctor wants that specific brand, so that's a time that they need to write down the brand name of the medication. So, say for example, your warfarin, for example. So these are medications that are not interchangeable. So when the doctor charts that, there is a separate chart for warfarin. But if the doctor wants to chart warfarin, they should indicate as well the brand name, which would be either in Australia we do have two, Marivan and Comadine. So the doctor should write the brand because they are not interchangeable medications. For oxycodone, we do have two brands that we normally give in Australia, but endone is always the most common. And so it is the understanding of nurses that when the doctor says oxycodone, it is endone. But it is a very good way to clarify oxycodone. Did you want, or did you want endone for this as well? Yeah. But yes,
Thank you.
best practice is generic name.
Thanks, Carissa.
Thanks,
Any other
Francis.
questions, guys? Yeah. All right. So this is how you would now write it. So this is like the example that was given to you. And if you guys can still put my highlight back in, you can see that the date. So I am the one normally who's going to write this because I'm the first nurse who's actually asking for the medication. And this is my patient. The date is in there, which is today. Oxycodone is in here, which is endone. Proorem, which is the, we've asked for this, 5 milligrams stat dose. This is my signature here. Carissa will now sign this after we finish the phone order. Dr. Pramod Ray Smith is the name, and the doctor will sign it here. And you will leave this blank until they come in. Now, this is not valid because the doctor hasn't signed it yet. We've already given the medication. I just realized. Anyway, the doctor has to sign this, eventually, okay?
And
You can
one more
see,
thing, please.
go promote.
May I ask? Yeah, then the time should be military time, right?
Say that again.
The time that we are writing, it should be military time, like,
Oh, you mean the 24 hours?
24 hours.
Yes, yes.
Yeah.
So should we mention PM, AM, or just write the
No, just write. So 12:30, that means 12:30 afternoon.
Midnight, yes.
Yeah. Otherwise, you need to do the 24-hour period, which is 1300, 1400, 1500, 1600.
You'll get familiar with writing the 24-hour clock, everyone. I mean, you get to see it all the time. When I started in Australia, long time ago, I wasn't familiar with those times as well, but you get used to it. So what you can see here now, there's a signature and there's a time. So that's me and Carissa. And this is after we've given the medication. All right. And now the doctor will have to sign sometime within 24 hours from this point. Okay. So if you can see here, I'm just going to clear this up. You can see here, guys, that there's other areas like this, special things. So these are like, if you're going to have to redo or give the medication again as a PRN, since this is actually a stat dose, you're only going to do it one time, isn't it? But if the doctor wants it as a PRN, then you would write it up as a PRN, then you can give it again in the specific time that is, what interval it is. Let's say PRN for 4 hours, PRN for 6 hours. But normally what will happen is the doctor will have to come up and rewrite this medication on the actual PRN section, okay? But 24 hours is a long time. So if you have to give the medications again as a PRN, then you'll have to write it up on the next administration dose. So, my advice for you is if you're a bit confused about how to fill it up, there's always your senior nurses who can actually assist you. And, if the other person that you ask for telephone or they would know, if you're filling it up correctly. Questions with this one, guys? We're good? All right. So let's do a breakout rooms. And this is one of the most key features. Do we have time? 15 minutes. These are one of the key features that we actually do for OSCE session. Carissa, how many students do we have?
We have 13.
14.
13 at the moment because Carla is from our team
for
marketing.
Okay.
So we have 13.
Okay. Oh, is she from marketing? I should have asked her and put her in the spotlight a while ago.
But she's also a registered nurse.
Okay. Well, that's a good thing. That's a good thing. All right. Now you can see here, actually, we got 2 scenarios, guys. Okay. So we have group 1 and group 2. And what we're going to do, just to give you an instruction, is we'll break you into groups. And this is what I call as a breakout groups. And essentially, you'll be put on automatically to a set of people on a group, and then you will now have to work and collaborate together. So the other group won't be able to hear you. We won't be able to hear you unless we've entered your group. And then we'll give you a specific time frame to work on something. And then you come back to the main, I would say, main hub, where we start presenting this session. Okay. So we will give you how much minutes, maybe, Carissa? 5-10 minutes?
Give them 5 minutes.
Yeah, 5 minutes. This is not a difficult one. And what we wanted to see, guys, is exactly what we did a while ago. So remember me, Carissa, and Pramod did the medication order, telephone order. And what you have to do is allocate on your group a doctor, a nurse, and another nurse. Okay, and this is exactly what you would have to do, the same as us. The documentation part, we'll leave it, because we don't have an actual, but normally on a real OSCE scenario, we will give you a file with your medication chart on it, where you can actually demonstrate how to enter the details on the medication chart. Okay, so it might be a bit, different for you guys. Oh, I can't actually do breakout rooms, Chris. Oh, yeah, I can do.
Ross, I'm just having a suggestion. I was thinking if we can just do it all together for
We
now.
want to do it all together.
Yeah. So I'm just thinking because we are recording the session, so I don't know where the recording will go.
Yeah,
once we go
true.
to
Yeah, I
breakout
totally
rooms.
forgot about that. Okay. So in a real scenario, guys, we normally break you out into groups. You will get more information about that when you actually start with us. Okay. Let's have a look at the instructions. Please work among your groups. You will need to have the documentation and the medication chart provided, so we're just not going to do that today. And each scenario will provide a feedback or comprehensive feedback. So let's have a look at the first scenario, guys. And what I'll do is I'll get someone to do a volunteer, okay? Let's just assume that you guys talk among each other and, you discuss this. I will get someone to do 3 people to do a volunteer for scenario 1. So let's read through this one. Miss Peterson is admitted to the ward post-appendectomy. Okay, she's expressed her concern that she was not feeling so well and in handling pain. So she's got a very low pain threshold. In fact, she's actually looking flushed and complaining of 8 out of 10 pain on her wound side. So that's pretty severe. She's also very nauseated and was unable to take oral medications at this time because she's feeling sick. As a nurse, you are recommended to obtain a telephone order for morphine 5 milligram stat dose as a subcut and watch out for any side effects. Okay, so shall we get some volunteers, guys? And this is your time to sort of practice. It's a good practice. So does anyone want to volunteer as a nurse? So we need 2 nurses and a doctor. Pramod is out of the picture now because he's done it already. Okay, so we need more other volunteers. Anyone, guys? Don't be shy.
One of the feedback actually of students after our OSCE online session is that they actually enhance their communication skills because they don't have any other choice but to talk. So
yes, we will
and
force you to talk.
Yes. And I think they said it's really good to look at people do it, watch videos. However, when they do it themselves, it is actually very difficult as well for them. So I think the best thing here is to try.
Absolutely. Any volunteers, guys? Nurse 1, nurse 2, and a doctor?
Gian, do you want to try?
Gian? She's no choice now. She's smiling. Gian, you're nurse 1, okay? All right, nurse 2. We need a nurse 2.
And I think I saw Karen somewhere. Maybe Karen wants to be the nurse too.
Yeah. Which Karen? I think we get 2 Karen. Karen Augustine.
Karen Augustine.
Yeah.
Are you there, Karen?
Yoo-hoo.
Yay.
There she is. All right. You're on mute, my dear. And who wants to be a doctor? Come on, it's your time to be a doctor. Doctor?
Dr. Ross, that can be you.
Okay, yeah, easy. All right. So, all right, Gian, Karen, shall we begin? Karen, you're in mute, by the way, my dear. So if you want to unmute yourself so we can hear you.
Yeah. Please bear with me. I wasn't the whole time here in the video. I was attending to my kids. So.
Gian
I'll
will
try my
guide you.
best. I'm nurse too.
You're a nurse too. Yeah,
Okay.
you're a nurse too. So
Who's
Gian,
our doctor?
I'm the doctor.
Yeah.
I'll
Sorry.
give you a hard time. I'm kidding. Just make sure when you go, so just a reminder, guys, when you do your telephone order, you need to do your complete handover. Like a quick, really quick handover. All the information that you require should be in here. Yeah, so if there's not in there, then don't worry about it. Okay, shall we begin, Jian and Karen? All right. Action. Ring, ring, ring.
Hello.
Ring, ring. Hello.
Hello. Good morning.
Good
Dr.
morning. Who's
Ross?
this?
Yeah.
Yes, yes.
This is Gian from Ward B.
Yep.
Yep. How are you?
I'm good. How are you?
I'm good, thank you. We just wanted to refer a patient of yours. She's Miss Peterson.
Yep.
She is one day post appendectomy, and expresses concern that she's not very good in handling her pain. So now she's complaining of pain 8/10, and she looks flushed, and she's also feeling very nauseous, and she's unable to take any oral medications at this time. So we just wanted to ask for your recommendation for PRN medicine, or
Yeah. So where's the pain site, Jian? Is it on?
it's on her appendectomy.
It's on the wound side.
Yeah.
And how's her vitals? Is it okay? Her obs?
As of now, her vitals are normal, but the pain scale is just what do you call this? It's a moderate pain.
Yeah. Was she not written for anything for pain? At all? Do you know? Did you check the med chart? No.
As of now, there is no current written yet.
Okay, that's good. Well, I'll review the medication chart later. So how about let's give her a morphine, just a subcut 5 milligram IM as a stat dose, and then I'll come back later and I'll review. I'll put some PRN medications for her. All right.
Yeah, sure, doctor. Let me repeat your order. It's morphine subcut 5 milligrams stat.
Yeah.
And we'll just watch out for some side effects after.
Yep. No problem.
I'll pass you to Karen, my co-nurse.
Yep.
Karen.
Hello, Dr. Ross. Yes, good morning. This is
Good
Nurse
morning.
Karen.
Yeah.
Yes, I work with Gian.
Yep. So the order, Karen, is morphine subcut 5 milligrams stat dose now. And then what I'll do is I'll come back later and review it. Okay. And see. And just make sure there's no side effects or anything. If there's any respiratory. Do you know what's her respiratory rate? Is it normal, Karen?
Respiratory rate, there wasn't any information about her RR right now.
Okay. Can you just find out, make sure that it's normal before you actually give the subcut?
Sure, doc. I'll monitor it before giving it. So can I just repeat what you said? Morphine subcut 5 milligrams stat, and watch out for the RR.
Yeah, excellent. All right, all good. All right, thanks everyone. Thanks.
Okay,
bye.
thank you, Doc Ross.
His name is Doc Ross.
How do you find that, guys? That's a typical doctor who's gonna be giving you a very hard time. So how do you find, and Carissa would testify to this, that's how doctors always do it.
It was the first time I did it in English.
Yeah, it's a good practice, isn't it? Gian and Karen, how do you feel it? Any comments from the group?
It's really hard when you do it in English.
Yeah, finally we need to inform the doctor, right?
Say that again,
Finally,
Prabhat.
yeah, finally, we need to inform the doctor that he has to sign within the 24 hours.
Yes, good pickup. Yep. So we forgot to mention. I mean, we normally know the doctor would know, but it is a good practice to actually tell them, oh, look, doctor, make sure you come back within 24 hours to sign the medication chart. So don't forget that. I'm a bit of a rush, if you can see. I just sort of wanted to hang up because doctors always have very little time to talk to you guys about things. So it's good to just sort of prompt that. And how about the way that, our two lovely nurses communicate? How do you find it, guys? A bit daunting? Are they lost of words? Are they sort of, how do they go? Comments?
It's okay for me. It was
Good for Karen. Good
yeah,
practice. How about you,
yeah, good
Gian?
practice.
How, how do you find yourself doing a phone order with a nasty
Yeah,
doctor?
it's really difficult to express it in English
Yeah.
as of now, right?
Yeah, that's all good. That's all good. And my advice for you guys, for everyone, before you call the doctor, if it's gonna help you, put it on writing, like write something or what you're gonna say if you're not very sure about it. Because a doctor like me or anyone who can be a nasty will keep asking you questions as like a supplementary information. Like I'm asking you about OBS, I'm asking about respiratories, I'm asking about, and you'll be like, oh, sorry, doctor, I don't know. The next thing will happen, I will just hang up. Yeah. And, I wouldn't care because, you wouldn't normally want to call a doctor with incomplete information. And time is really, really important, guys. And just some quick feedback, obviously, Gian. I think, you know, uh, just a personal comment. I think you probably want to go a bit more quicker with the way you speak. And that's just a constructive feedback for me. It's good. You've done everything, but seems like, I'm waiting in vain. Oh, what's she gonna say? Which is good, that's what we're here to do, guys, and practice and practice and practice. All right. Carissa, do you have any comments?
Yes, I do have. Thank you, Ross. Wonderful scenario. Very, very good scenario because this actually happens um, a lot of times in the hospital, post-surgical pain. So, GN, you've done so well when you introduce your patient, has given the situation why you were calling the doctor, given the background, telling the doctor the vital signs, and also asking for the recommendation of, you did not really specify it's morphine because we don't really know what the doctor would
Yeah,
have
absolutely.
wanted. So that is a very good way of saying it. Definitely a lot of room for improvement when you keep practicing, and this is why we're here for, because it is muscle memory. You always, it's just more of getting used to it. I like when you comment, Gian, when you said, "Oh, it's really hard to do it in English," and that is
It
correct
is so
because
true.
listening to people doing it, or even watching English movies, it sounds so easy, but when you're actually the one expressing it, when you don't have a script to actually read it, I think it becomes very challenging. And finding the right words, which we will be teaching you in your real OSCE class, we do have the powerful words to gain the confidence of your examiner. And these are the words that you need to inject during your OSCE so that your examiner actually would know, oh, okay, so she knows actually what she's doing. So, but definitely there is a room for improvement there, a lot of rooms for improvement, because we really want to be safe practitioners by the end of the OSCE course. So well done, Gian. That was a good try for the first time. And also for Karen, she was saying it's my first time to do it in English, and it was okay. So I think it's when Karen said it was okay, I just had a presumption like, yeah, it was okay. It was my first time to do it in English. There are a few things that I need to improve as well in there. And I think with the situation or the scenario that Ross has given us, actually, which is very simple, and you can feel that when you actually say it, um, you need to find the right words, because as Ross was saying, doctors, as much as we would like to we respect them for what they do, but they're very busy people. They could be operating at the time that you are calling. They could be in a conference at the time that you're calling, and it is their obligation to actually answer because it's their patient. So that's the reason why sometimes they can get very upfront and be in a hurry. Okay, so what do you really want? And that is the reason why Ross was saying, like, oh, I'm waiting in vain, because I was also thinking of Ross being on the other side, being the doctor. I might be doing some surgery. Like, tell me what you want to, tell me what you want now. And this is reality. This always happens. Sometimes you call the doctor in the middle of an emergency in the emergency room, for example, and they just want to get it as quick as possible. Um, it is best practice to still follow our ISBAR handover. Best practice to still tell the doctor all the information so that the doctor can actually make an informed decision when making the phone order. So, as much as I want it to be fast, doctor, you need to know these information because these are very significant for your patient. And well done for the first try. Thanks,
Well done.
Ross.
All right. Okay, let's do one more, guys. So this is the last one. Carissa, you'll be a doctor now. I'll put you
All
on the
right.
spotlight. All right. Anyone who wants to be a volunteer, guys, I think you should be able to do it more, more properly now. I wouldn't say it's not properly a while ago, but more, more precise. Anyone who wants to volunteer? Or shall we pick names again?
I was thinking Sarah. Sarah is
Sarah?
showing. Give it a try, Sarah.
Sarah, you'll be the nurse one. Excellent. She
And I
has no
saw
choice.
and I saw Jatinder a while ago, so maybe Jatinder wants
Okay,
to give it a go.
Jatinda. Jatinda. She's got her baby on the picture.
Jatinder, are you there?
Did you get a
Jatinder
camera
doesn't want to
on?
talk. She was on camera a while ago, so maybe, and though she has,
Yeah.
I think her son a while ago as well.
Maybe
That's
she's
okay.
at.
Maybe we'll try.
Wait, yes,
Oh, there
sorry,
she is.
I'm
Jatinda's
with
there.
my kid.
Oh, okay,
Okay,
Sorry.
Jatinder.
that's
Yeah.
all good. Yeah, we'll give it a miss for you. How about so who do you want, Carissa? Do or Ria? Or yeah. Anyone, guys? Come on. Do, are you there? Do. Because she was in a while back, isn't she? I'll
Yes.
ask to unmute and see if she can do.
I was thinking, Jatinder, would you like to give it a try? We are very considerate of having your kid next to you.
Jatinda, you want to try as a nurse too?
Just like Karen having her kid.
Actually, I'm giving him a bath, so I'm just listening.
That's all good.
Sorry.
Okay, cool.
All right. So what about if we do Sarah? Sarah, you're on mute. We can't hear you.
We can't hear you, Sarah. Do you have a mic on your device or earphone or something?
Hello,
Yeah.
can you hear me now?
It's very faint.
It's faint.
Yeah, we can't hear. Are you using your phone, Sarah?
A computer.
Our computer, yeah. Do you have like an earphone you can plug in with the mic? It's very faint, unless you're gonna talk closer to the phone, to the laptop.
Can you hear me now?
Yeah,
That is faint.
not very good.
It's all right. I'll try in the next class. I'll try in the next class. I would have sorted out my computer.
Yeah, I can hear you, but very, very faint.
Is it okay? It's okay. I'll sort out.
I think you should be okay. Yeah, that's better, Sarah. So we can proceed. Yeah.
I'll try again on the next in the next lesson, in the future lesson.
Okay. All right. We'll give it a miss for today. All right.
Let's do it together.
Okay. How about Marisol? So we don't waste time, guys. Marisol, are you there? I'm just randomly picking person. Marisol.
And this doesn't happen in the real OSCE class because everyone is sharing their camera.
Because you have to share your camera. We know who you are. Marisol, are you there?
what we can do, Ross, maybe we'll just do it together with everyone
Okay.
who's
Let's
here,
just do it,
who's
yeah.
participating.
Yeah. All right.
We'll get Pramod to do it then,
Pramod,
because
you'll be
Pramod
the
was a
nurse one.
doctor.
Yeah. Okay. So I'll be nurse. Who do you want me to be, Carissa?
You'll be the doctor. I'll be the nurse too.
I'll be the doctor again. Okay.
Before the second scenario, may I ask one thing?
Sure.
In the ISBAR, the last section is a recommendation, right? So from the nurse's standpoint, can I recommend the doctor the medicine? Like, doctor, can you please prescribe salbutamol, like the previous scenario? Can I recommend doctor morphine, or is it doctor's
You may.
scope of practice?
You may recommend, however, the doctor may or may not. It's a recommendation anyway. You can say, I'd like. So your recommendation is actually a phone order. It's not a specific medication. But if you would know, so say for example, the patient usually takes salbutamol 200 micrograms 2 ml nebulizer as a PRN dose at home. Are you happy for the patient to have this as a stat dose? So you can also ask that question. If you know the patient already, that a patient has been having that. However, the best practice is just ask a phone order, because it will be a doctor's. The doctor will decide of what medication.
Because for the last two scenarios, I saw that in the section as a nurse, you are now to recommend this medication. So I thought it's our scope of practice to recommend.
Yeah, no, that's a good pickup, Pramod. But yes, I think the most common recommendation that we do is IV fluids when you're doing a phone order, because let's say, oh doctor, so let's just example, like a blood pressure is going down, and then you wanted to get some fluids up, and you can recommend to the doctor for saline maybe or something. But medications, you can, depending on the situation, like what Carissa said, but they will still have to make a decision on that. So I normally recommend, Carissa.
Yeah,
I was a doctor.
I
Can
do.
I get an endorse for this? But yeah,
I do. Yeah, I do as well. Specifically, if you already know the patient.
Yeah.
The first scenario was like, doctor, this patient already has paracetamol and Nurofen and has taken them. And this patient actually stated that endone works best for her pain. So then you can ask the doctor, is it possible to get a phone order of endone? And that is fine as well.
Yeah. All right, let's begin. Pramod, you'll be my nurse one, and I'll be the doctor. All right. Action. Ring, ring, ring.
Hi, doctor. This is Pramod calling from Hospital of Sydney, cardiac ward.
Hi. What's up, Pramod?
How are you doing, doctor, today?
Good. I'm a bit busy.
All right, doctor. I'm sorry to disturb you
That's okay.
Yeah, doctor, I'm calling with regards to one of your patient named Mr. Lloyd. He is 5 days. He's on 5th day of cardiac reconditioning. Today morning he pressed a call bell, and he asked for assistance. When I proceeded with the situation, I came across that he complained about breathing difficulty and shortness of breath. And when I checked the vital signs, his respiration is around 14. So his back when I checked his background, it states like he has 25 years of smoking history and worsening lung condition. And also, doctor, Mr. Lloyd is also having a cardiac recongestion as per his readmission and reconditioning. So, doctor, can you please recommend a nebulizer to relieve his shortness of breath?
Yeah. What was the respiratory rate again, Pramod? Did you say?
14.
14, and he's having short of breath, isn't it?
Yes, doctor.
Yeah. Is he lying down flat, or is he upright? What position is he in now?
When he complained about this shortness of breath, I put him in a semi-follows position, but still I'm not seeing any improvement, doctor. That's why I came across the below.
And his the other vitals are okay?
All stable, doctor. All stable. Yeah.
Okay. Yeah. So do you know if he's having any other nebulizer? What kind of nebulizer does he use before?
Doctor,
is there anything PRN written for him before, or what he take?
Nothing, doctor. Nothing in PRN.
Okay.
Yeah.
All right. Okay. So how about let's give him let's start with salbutamol, 200 micrograms, in 2 mils. That's nebulized as stat dose, and I'll see how it goes. Can you call me back after maybe a couple of hours,
Sure,
just to see
doctor.
how his shortness of breath comes in, and please make sure he stays in bed. Don't let him go walking around, and keep it in an upright position, please. About 45 degrees would do. And can you also check the vitals, possibly every hour, just to see if that rest rate is gonna go up, or and see how it goes. All right.
Sure, doctor. Doctor,
All right.
before hanging up, can you please repeat the order? Is it salbutamol 200 microgram per 2 ml stat dose?
Yep.
Okay, doctor. And as you recommended, the patient should be in 40. I should keep the patient in 45-degree angle, and the vital signs should be checked every hourly, right?
Yes.
Okay, doctor.
No problem.
So, doctor, one more thing, doctor. For the verbal order, I need to reconfirm with one of my colleagues. Can you please state that order once more? I will hand over.
Sure. No problem.
The second.
Hello, Dr. Ross. This is
Hi.
Carissa.
Hi.
Pramod is just writing the order right now in the medication chart. So, by the way, this is not part of this simulation. At that instance, Pramod is now writing it's salbutamol 200 micrograms, 2 mil nebulizer stat dose. With S8 a while ago, we actually asked the doctor to repeat the order. This time, that if you want the doctor to repeat the order, that's fine. That is not minus in your OSCE point. But at a minimum, the nurse should repeat the order to the doctor, and the doctor will confirm.
Yep.
So now that Pramod has written the order, I will just read. So Dr. Ross, you have ordered for Mr. Lloyd, who's got shortness of breath, for salbutamol 200 micrograms per 2 mil as a nebulizer stat dose.
Yep. Yeah, that's correct. Thank you.
Thank you very much, Dr. Ross, and we'll see you in the next 24 hours to sign
All
this
right.
order.
I will be there after I finish operation. Okay, bye.
Bye. Dr. Ross, sorry, you forgot. Can I just get your last name, please?
That's Pancho, Pancho.
All right. Thanks very much, Dr.
No
Ross.
worries.
Bye.
Thank you. Thanks. Bye. All right. So what do you guys think? Pramod, any comments on how you did it? It's a bit difficult if you're the one doing it, isn't it?
Yeah, but a lot of information I have,
Yeah, that's so true. Yeah, this patient's a little bit different with what we have a while back. And I think one particular one, Promoter, you forgot is to reconfirm what kind of route or route of administration. I sort of pick it up. You said salbutamol 200 mics in 2 mils, but you also need to mention it is, of course, it's a salbutamol nebulizer.
Nebulizer, yeah.
Yeah, but that's part of what we do when you do your 6 checks, your 6 routes of medication as well. Otherwise, not too bad, not too bad. Yeah, maybe reconstruct most of your sentences quicker, because I'm a bit lagging around and I was busy. And you can see that the doctor always wants some extra information, and they always do that, guys, by the way. You're only asking for one thing as a phone order, and they're going to give you 10 million other requests for your patient. And that's just basically how multidisciplinary team approach goes. Okay, we're trying to make it more realistic. Yeah.
Sorry, Ross. Sarah has a question.
Hi, Ross. Sorry to take you back. In the event that the orders are a bit long, is it allowed that you ask the doctor to say them out as you write them down so that you don't get to forget them? Is it allowed?
Yes. Sometimes you even say, wait, doctor, what did you say again? Salbutamol. Okay, salbutamol. What's the dose again? 200 micrograms per 2 mil. Okay, so it's 200 micrograms per 2 mil. And what's the route again? Did you want it as a nebulizer? Yes, as a nebulizer. And did you just want it one-off dose as a stat dose? Yes, as a stat dose. You can do that as well. The reason is, at the end, we are still accountable for what we have administered. So if you cannot get that clearly, you're still accountable for it. So you better just make sure that you validated the right medication.
Thank you.
That's all good. And don't feel intimidated that you keep asking the doctor about the order, because they know that it is our responsibility to make sure that you've given the right medication. They would know that. If you didn't hear it properly, and that's absolutely fine, you can ask them to repeat the order. Because it's a phone order, guys. A lot of things can happen. It can be a bad line, it can be, the accent possibly, you can't pick it up. All right. Any other questions, guys?
And majority of the doctors, don't get us wrong, majority of the doctors actually cooperates because they know that it is also our accountability. So
Yeah.
they're very cooperative, very
They're very
good, very
cooperative.
kind, very respectful, which is part of our standards, which is partnering with consumers as well.
Absolutely. You probably won't get to deal much with difficult ones. I hope so. All right. So that ends up the topic for today, guys. I hope you learned something. Do you have any questions for us? We sort of exceeded 15 minutes. Any questions? This is your time to ask anything, to Carissa, to ask, about anything. Doesn't have to be the topic today.
No, doing such skills, even if we polish all our skills in such a scenario, can we make use of, because it is a like when I check the verbal regarding this scenario, is it possible to make use of the whole 8 minutes, or can we cut short within 5 minutes? Because when I think when we did the scenario, it only took like almost 4 or 5 minutes. So
are you talking about the actual OSCE exam?
OSCE exam, yeah.
Yeah. So
even if we polish our skills, is it possible to lengthen the whole scenario till 8 minutes, or is it even if we polish our skills?
So if you sort of look at the fact sheet for the OSCE for OBA, it specifically tells you guys there that the scenario-based reading and reading of the documents is 2 minutes. That's before you enter the actual testing room, what the scenario is. And the 8 minutes should be consumed on the actual skill performance. So there's no reason to actually go extend or beyond that. If you finish before the time is up, that's absolutely fine as well. But the 2 minutes is dedicated for reading the scenario, and then the 8 minutes is dedicated for the skills. So is that what you're asking, Pramod?
Yes.
Yeah. So on what we do with OSCE face-to-face, we do a mock exams for OBA, which we set up all our training rooms to be exactly how it would work on the OBA exams. So we have like scenarios for you that you check for 2 minutes and then, do the timer, then go inside and then perform the skill. And there's a specific assessor. One of us as educators will do the assessment for you. And then we provide you feedback. So that's the only thing that you don't get on the exam. You get the feedback because that's an exam. But for us, obviously, we'll have to give you a feedback about your performance.
Usually, how much time one of your best students consume, for such a scenario?
It depends. It depends. There are some really specific long scenarios that promote, like medication administration, almost just cut that break-even time of 8 minutes. There's some quick ones, maybe ISPA would take you about less than 5-6 minutes. So it really depends on what is there. But these exams are constantly in review. What it means is, there's quality assurance that they do with the exams. And this is the second time I believe we've done first one in February with OSCE. And, they're getting feedback from the first group of examining students who took the exam, and then they'll improve on that. So maybe they'll have some feedback about a particular skill that is too long to be fitted into 8 minutes or something like that. But at the moment, we don't have any sort of concrete information.
So usually telephonic orders are not that much complicated, right? We can finish within 5 minutes, 6 minutes.
It should be 5 to 8 minutes is the maximum, because the skills, there are 10 skills that they would be assessing you, and those skills have been that's been piloted. They've done some pilot testing on it before they even make it as an actual exam thing. So yeah, Carissa, do you want to add something?
Sorry. Yes. So it is a very measured test. for the information of everyone, it's a very measured test. No one really knows what will come out, what is in there. It has been validated for sure because it is a regulatory exam. What NETA provides in the preparation is to make sure that not just the skills that you'll be able to learn, but also to manage your time. So, how do you say a cheat sheet? So we actually have a cheat sheet for you, so you will know that in this much minutes, how much time should I, in this much skill or in this much procedure, how much time should I put on? So say for example, Ross said that we have actually trialed, say, medication administration, which will be another demo class, medication administration via IV infusion, actually would just reach 8 minutes. So we have a cheat sheet for students that your introduction would only be about 20 seconds, for example, and then you need to move on to the next, because if you go on for 30 seconds, you don't have any room for you to be able to correct any mistake that you have when you're doing the scenario. So rest assured, we will teach you how to get there before 8 minutes. Our target is that on the 7th minute, you're done with your scenario so that you can wrap up everything and you can still correct if there are some other skills or some other procedures that you fail to perform, or you forgot, or when you're not able to do the third check, for example. So then you will add that up in your demonstration. So um, with your question, Pramod, with the, if it's only for 5 minutes, that is completely fine. Yes, for 5 minutes, that's fine, but we don't waste those 2 minutes because we want it perfect. We want to make sure that you have the best practice that you perform to the NMBA assessors. So what does it mean is, yes, you only have 5 minutes, but doesn't mean you need to be confident that, oh, I finish it in 5 minutes. We will teach you the whole process where you can get everything done in 8 minutes time. There are skills that probably would take probably 5 minutes, but there are so many powerful injectable words that you can put on, and that will make it 7 minutes in total, just for you to add on more to increase the confidence of your assessors, that you actually have the knowledge, not just the skills and the attitude, which is your communication, but also the knowledge in delivering the skill.
Yeah, that's what I wanted to know. Yeah, that's why I asked, when I polish my skills, because now today I made many mistakes, many hiccups. So once we practice and practice, I just want to know, because you have seen many best students, how much time they have used for a particular scenario. You know better, right? That's why.
Definitely. And look, again, we say it's always a muscle memory. And this is what we tell students. When you go and say, hi, in your neighborhood, hi, hello, how are you? That is a muscle memory, that every hi, hello, it is always followed by how are you? And then our muscle memory says, I'm good, thank you, how are you? And then another muscle memory would say, I'm good, thank you, how are you? And we keep asking, how are you? So it is a muscle memory. And what does that mean is that with a skill, it is always muscle memory. The first time that you probably made up an antibiotics, or, maybe opening an ampule, as simple as that. Opening an ampule for you in the beginning was quite hard. You didn't know. Maybe you cracked the ampule. Maybe you open it towards yourself, and then there were splashes to you, or there are some certain ways where it wasn't a pleasant experience for you. But now, as many, you've opened ampules many times, what happened is you can close your eyes, open the ampule, and it just opens easily. So it is muscle memory, and that's what we tell our students. And that is the reason why you have your workbook, you have a lot of exercises, and on top of that, you have your face-to-face, because that actually will help you become more confident because of your muscle memory.
Any other questions, guys? Thanks, Carissa, for that. All good? All right. Chris, I'll leave it to you for the closing.
All right. Thank you so much, Ross. You have given us a lot of oh, Sarah's just put a thumbs up, but you've given us a lot of knowledge and also we've exercised our skills. And I know this is a demo class and there are a lot more to learn. This is just one part of the nursing skill. Out of the many. So thank you very much for your knowledge, Ross. And also to everybody who did participate, put on their knowledge as well, share their ideas and experiences. Thank you very much. We will be uploading this video in our YouTube page so that everybody will be able to review this, and to those who missed this session as well. So I think that's it. And thank you for extending your time, by the way. And thank you for participating.
Thank you.
We will see you again in the future. If you have any other questions, or if you want to know more information about the OSCE classes, please feel free to contact our office and or visit the website and send your information there. So our email address is info@nursingeta.com, and we do have a 1-300 number. It's 1-300-00-6382 or 1-300-00-NETA. All right, guys, thank you so much for your time. We will see you again next time. There are a few chats. Let's just open this. Thank you, Ross. Thank you. That was so informative. Perfect. Thank you very much, everyone. Bye for now.
Chris,
Thank you,
I'll
Ross.
see you
Thanks
next
for it.
time.
Thank you, Ross.
Bye, 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 bye. Thanks, bye, everyone.
Bye bye. Thank you.